Good afternoon. This is Jeff Marshall. I'm the current president of SCAI, and I'm really happy to be here today with Dr. Cindy Grines, who's the vice president of the Cardiovascular Institute at Detroit Medical Center. And we're here to discuss today a really fascinating economic study done out of the University of Pennsylvania on comparative costs between non-invasive or less invasive studies or procedures compared to invasive studies, just recently published in JAMA Surgery. Good morning, Cindy.
Good morning, Jeff.
This is a fascinating study, and I think it really showed some of the economic benefits of angioplasty. What's your take on this study?
Well, Jeff, we've always known that angioplasty saves lives in patients with STEMI, and with ACS patients, it reduces death and MI. And in all patients, it improves quality of life. But the added benefit now appears to be an incredible cost savings and the ability to get the patients back to work much more quickly compared to open heart surgeries.
The savings were pretty profound, and really the savings on PCI really drove the endpoint in this trial, didn't it?
Absolutely. It appears that we can save about $30,000 per patient over the course of the first year if they have angioplasty compared to bypass surgery. That's very impressive.
Wow, that is impressive. And you know, people were getting back to work a lot faster too, weren't they?
Absolutely. It appears that they get back to work 38 days more quickly than patients who undergo bypass surgery. So that's several weeks of additional ability to contribute to the workforce.
Well, that must have really driven that economic impact, because getting back to work is one of the most important things, even for our patients and their quality of life. So this is a fascinating and I think very important study.
Absolutely. I mean, patients really want to be productive and be important in what they do every day. And so the ability to get back to work almost 6 weeks earlier is quite impressive.
Wow. Now, this study also looked at PAD therapy. So the difference between angioplasty and stent placement versus open procedures. What did it show in that regard?
Well, there was also cost savings to undergoing peripheral interventional procedures. And in fact, there was about $12,000 cost savings. And those patients also returned to work more quickly, about 17 days more quickly compared to patients who had open peripheral procedures.
Wow. So getting back to work's 2 weeks earlier. I mean, this really confirms a quality of life issue that we actually did surveying patients, showing that patients that receive angioplasty compared to bypass surgery and now even peripheral procedures get back to work sooner and have a better quality of life. And now, importantly, tremendous cost savings. I mean, what do you think the impact of this is going to be on the national debate about healthcare policies?
Well, certainly if a patient's eligible for a minimally invasive procedure, not only do they prefer it, but there's a lot of economic incentives. And so hopefully the government will promote more of this type of treatment.
Well, Cindy, I appreciate you being with us here today. This is a fascinating study out of JAMA Surgery showing that angioplasty is a tremendous cost saver compared to open heart surgery. We appreciate your time and look forward to talking to you in the future. Thanks a million.
Thank you, Jeff.